Hey guys, welcome back to my channel. So today we're going to talk about how to do well on your family medicine rotation. So I forgot to mention in my last video, but I got a ring light. So now look how bright it is over here. So this rotation is normally done in the outpatient setting, so it's a little bit different. Normally, you come in to see the patient with the resident, and the patient's fully dressed in their street clothes. After you see the patient and examine the patient, you and the resident then leave and go present the case to the attending, who then comes in and sees the patient for themselves. After the encounter, the patient goes home, and you and the resident prepare to see the next patient. So what are some things that you can do to get great evals on your family medicine rotation? You may be able to pre-read about your patients from the EMR as they come in, depending on if you have access to the EMR. Personally, I didn't have access, so I wasn't able to pre-read about my patients, but my residents would always give me a little bit of backstory about the last time the patient was there, because this is most likely going to be in a continuity clinic with patients who continually come back year after year, and there should be data about them from previous visits. If you do have access to the EMR though, and you can pre-read about your patients, you definitely should. Once you start to feel more comfortable, and after you've seen a few encounters done by the residents, you can offer to do a focused physical exam on the patient based off of their chief complaint. So generally the patients in the clinic are more healthy than the patients in the hospital. So when they come in and they have a chief complaint specific to a specific body system or part of their body, it makes more sense to do a physical exam that is more focused to that person's complaint and to that part of the body. So you might begin by, feeling for lymph nodes and doing an HEENT exam. You might listen to their heart and their lungs, but their main complaint is really their elbow hurts. You're going to spend more time focusing on their elbows on both sides of the body because you need to compare, and seeing their range of motion in joints one above and one below. That's generally what we do. There's some specific maneuvers you can try to determine, do they have any sort of tear, or do they have any sort of break? But you're definitely going to spend the most time focusing on what the patient is most concerned about in this type of instance. Also, after you feel more comfortable, you can attempt to present the case to the attending once you leave the patient encounter room with the resident. This presentation is going to be just like your internal medicine rotation presentation. It's going to be nice and organized. It's going to include the patient's past medical history and their chief complaint this visit. And you're going to go ahead and give concise, pertinent positives and pertinent negatives, but be prepared so that you can answer any questions that the attending might have. So a really cool and exciting thing about this particular rotation is that you can actually get your hands on some needles. That's weird. But what I mean is that you can ask to learn how and offer to give vaccinations to patients. In this rotation, you're not only going to have patients who are coming in for their flu shot or potential other booster shots, who knows, but you'll have older patients coming in and they're going to need vaccination against like strep pneumo and against shingles, things like that, and it's related to their age and certain milestones. So you want to make sure that you learn how to give those intramuscular vaccinations at least, and this is really awesome because you can do it while the patient encounter is going on, which helps be one less thing that the resident has to take care of, and you get to practice. Very cool, very fun, a little bit scary. A really, really huge thing in this particular type of rotation is knowing what screening tests are needed and when. So in family medicine, especially in outpatient, you're going to be dealing with the patient's primary care physician. And this primary care physician needs to be on top of when does the patient need a colonoscopy, when do they need a chest x-ray, when do they need screening tests to check for and prevent serious illnesses. So that's something that will help you on your shelf exam, and that's something that will also impress your resident and your attending if you're able to say, oh, we need to make sure that this patient has had this type of screening test done or that type of screening test done. How are we going to prepare for the shelf exam? So even though I mentioned that there are vaccinations that do get performed in the family medicine rotation, I do not recommend memorizing the vaccination chart. Yes, family medicine physicians can see the entire range of the human lifespan from childhood to adulthood. However, in this particular shelf exam, you're not necessarily going to have so many questions about childhood vaccinations. If you do want to spend some time trying to memorize a bit of vaccination milestones, I would suggest to focus on those in the elderly part of life compared to childhood vaccinations. I 100,000% recommend doing the practice quizzes that are available on the AAFP website. It's completely free to get a membership, and they have these little 10-question quizzes that are relatively easy, but the information there is super important for your shelf exam. And doing those questions in tandem with your UWorld questions really helps improve your scores, or at least it did for me. These questions help to hammer home specific ideas that your mind should automatically go to when faced with certain circumstances. It's never a good idea to wait to start doing practice questions. I always recommend doing practice questions as soon as you can, starting the rotation, even if you want to give it a day or two to get used to a new rotation and then start practice questions. Just make sure that you're doing questions throughout the rotation and you should be okay. So another great way to prepare for the shelf exam is to take care of those ambulatory medicine questions on the UWorld question bank. You can also incorporate some of those internal medicine questions that you didn't yet get to finish, because family medicine doctors, when they do train in the hospital, they will be experiencing the same things that you see in internal medicine. Again, similar to what I mentioned in the internal medicine video, I do know that some of my classmates did read some case presentations and specific case workbooks for preparation of the shelf exam, but I personally didn't do any of those passive learning resources, and I knocked the shelf exam out of the park just using those AAFP questions and the UWorld questions. Depending on the site that you're doing your family medicine rotation at, it can either be kind of chill or it can be kind of heavier workload, depending on the resources that the space has where you're rotating for family medicine. You want to know that going into it so you can make your study plan. So definitely make sure to ask people who have done the family medicine rotation at the same site as yourself, what are the resources like and what is the typical workday like, so that you can get an idea of how to prepare for your exam and how to make your study schedule. Okay, great. Thank you so much. Hope that this was helpful, and I'll see you guys in the next video. Bye!